You and Your Health with Dr. Richard Okoye.
As journalists, curiosity is one of the hallmarks of our profession, and our attention has been drawn to the several medical outreach programs being sponsored by Doctors Save a Life Foundation within and outside Nigeria. The questions that readily come to our mind are: what motivated this initiative by a single individual? What is the driving force behind the passion to save a life? Again, what sectors or categories of the population are the most benefited? Now, to find the answers to these and several other questions is Dr. Richard Okoye, President of Doctors Save a Life Foundation. I'd like to say welcome, Doctor, once again to this segment of the program.
Thank you very much.
Now, I'm beginning to wonder, as I asked in my earlier introduction, what motivated you to initiate this Doctors Save a Life Foundation?
Yeah, it is something I would say it's more of, if you use the word they're calling, that could be better described to be so, because it is more of an inspirational thing. I remember specifically in 2003, there was a very horrifying statistics that came on board that stated that 2/3 or more or less 72% of death that occur secondary to HIV/AIDS, happen in Africa and sub-Saharan Africa precisely. That got a lot of people talking, saying that, the problem is because of, poverty, a lot of analysts, socio-economic status of the people. But while I was listening to them, I got this very inspiration. He said, poverty is not the cause of healthcare crisis in Africa, because poverty is a global phenomenon. Of course, if you get to UK, you get to United States, you will see a lot of homeless individuals. They don't have any home. Poverty is well defined also in America. There's no two ways about that. But he said that it's a global phenomenon. But the problem of the healthcare in Africa is a product of lack of health information. And he discovered that when it has to do with health, regrettably, why we actually pointed out last time on the emphasis of the state, the role of the government and the mentality we started to operate our government, be that as it may, the genesis of health crisis globally, and I'm talking even only about Nigeria or Africa, because healthcare is still a major issue to be tackled across the globe. We get to US, is still a major issue also over there in Europe and all that. So, but he said the problem originated from information not being available to common man. And how did it start? Our fathers of medicine started medical profession or medical science as a fraternity. A fraternity this time around, not like an evil a dimension, but perhaps with the intention of monopoly, that when you have these stores. So what they did is that instead of allowing medical information or issues to come in the plain language, if it's English, it becomes the common English people speak. What they did is that they coded medical terminologies in a way that a common man will not be able to access it. That's why if you have something right now like malaria, instead of a doctor plainly telling you you have malaria, he may tell you that you have plasmodiasis. All right? While you are still talking with him, you may have one signature and some these two BD, TDS, QDS, and funny things. So you just come out. So when we ask somebody who has just visited the doctor or consulted the doctor, he say, what did the doctor say that is your problem? Do I know? He doesn't understand. So that actually created a platform where you are seeing all the crises which we will actually get to. So if you look at the dictionary, for instance, the longest word in the dictionary is a disease. It's a 45-letter word. It's called pneumono-ultramicroscopic siliconeovulcanosis. So, when they tell you that that is your problem, just like that, doctors tell you that your problem is pneumono-ultramicroscopic siliconeovulcanosis, then you will realize that COVID-19 has an option of quarantine and isolation. Because you will think that
you're dead already.
Yeah, you're already giving a death sentence. Yes, I mean, if they give prescription for you, you may drop the prescription and buy coffee. That's why most times, even the drugs we give to patients, they hardly take. Once they get fair enough, they don't understand why they should go further. That's why most of the chronic illnesses in this side of the world, like hypertension, diabetes, they all run into complications because the right information in their own language are not being communicated to them. So that's why God gave me that very insight. Say, decode this medical terminology in a common man's language, that by so doing you will save millions of them in Africa. He said, go save a life. So that is the origin of the name Save a Life. So it's more of a mission to save life. That became so revealing when I started up an outreach program 2003. I went into some communities like in Ogoni community in the River State. I spent about 2 months in that community, but not just giving them drugs. I started teaching them, like if it's hypertension right now or diabetes, for instance, I teach them in their language, like if somebody has this, these are sign of hypertension, these are sign of complication of diabetes, or this, that. I discovered that over the time I was there, if somebody has headache, an old woman will say, have you checked their BP? Someone urinating too much, have you gone to check their blood sugar? So I discovered that the problem is not just all about giving the drugs or treatment. People need to be well informed. So education is the bedrock of healthcare. If people are not well informed, you are most likely to have a lot of crises, even in attention to manage it. Ignorance is the mother of personal destruction, a voluntary misfortune, and it is worse when you are ignorant of your ignorance. Doing something same way, expecting a different result, is another demonstration of madness. If you have done what you think you know concerning that your health problem, why not seek for professional advice? If you lose money, you lose something. But if you lose your health, you lose everything. Hear this, you don't need things to enjoy life. You need life to enjoy things. Give your health professional attention.
You and your health with Dr. Richard Okoye.
I'm a bit concerned about the fact that you said it is not poverty, but the education of the people.
Interesting.
But I would also want to put it to you here that poverty has a lot of role to play, even if you are educated. Why did I say so? I may have the education of knowing that I need to check my blood sugar or my blood pressure if I have a headache or I urinate frequently. But again, if I do not have the means of purchasing the drugs to take care of it, then poverty comes in.
No. See, it is a function of priority rather. Okay. The same education will be able to give you the understanding of giving the right priority to your health. When you have, like I earlier said sometime, that the problem here is that we share what is called slave mentality. You got it right. Whereby we have little to care about our health. We can buy clothes, buy a car, buy this when you have money. But as soon as it gets to your health, you transfer it to prayers or God's responsibility, as it were. So because that right information has not been given. Why education is very key is that if you see a medical doctor, like if there be an emergency, for instance, people will rush to the hospital and carrying the person, perhaps somebody who collapsed, and I say, doctor, do something, doctor, do something. And the doctor will walk out, relaxed, taking his little time, you will be expecting the doctor perhaps to be doing some gymnastics. He's calm. Why is he calm? He's calm because he knows. Like in a situation, there's one woman that had hypoglycemic coma. She took over drug of a diabetic drug and went into coma. So they rushed the woman and the family almost fought everybody, do something right now. Only for the doctor to go and get 50% dextrose, having discovered that the sugar level is low, and put 50% dextrose. The woman woke up like Lazarus. People started shouting, he performed miracle. What he demonstrated is knowledge and nothing more. When you are well informed, it gives you some level of stability.
Hello, I am Pastor Barrister Austin Nadi, the Country Director of Dr. Save a Life Foundation. I'm inviting you to join this life-changing and destiny-reforming foundation today.
Join Dr. Save a Life Foundation.
You can be part of it by calling those numbers that are running on your screen right now, or visit our website on www.drsavealife.org. Together, we can save a life.
You and Your Health with Dr. Richard Okoye.
I want us to go back to the activities of Dr. Save a Life Foundation. I told you from the beginning, or I told the viewers from the beginning, that my attention was particularly drawn to all of the medical outreach programs that the foundation had been into, and a particular one that struck my attention was the one that was sponsored by the foundation, the Save a Life Foundation, for a widow who was almost crippled, and all of a sudden she started walking again. I don't understand what happened there, but I would like you to, throw more light on how the foundation, first of all, discovered the woman and went ahead to sponsor her, medical treatment.
Yeah, actually, it says such as I have, I give it to you. All right. Dr. Save a Life Foundation is a non-governmental organization. We have a vision of revolutionizing healthcare. But when it has the armor of the education, most importantly. If you educate somebody about his health, you have done 60% of his health needs, because you will now get to know what to do in order not to have complications. All right? As the first line of action. Second one is that for those that also will be obviously in need, particularly the indigent, just like we do sponsor some of these indigent couples having a need of this because of this IVF becoming too expensive. You find a couple that love themselves, but because of there's no money. Do you understand me? They start having a lot of marital problems. So that's why every year we make a provision to sponsor about 50 of those indigent but infertile couples having married for some years, not being able to achieve pregnancy, but there's no money. So we also make provision for that, in addition to going out for outreach programs in different communities. We teach them and also assist. But we are not so much putting emphasis on just giving drugs. Because if you give the person drugs today, what if it's tomorrow? So we tend to piece or emphasis, get this person to know what his problem. Do you understand? And those that are obviously in need, we can now sponsor. Just like the woman you are talking about, arthritis is a common thing among our people, unfortunately. And God said that I will satisfy you with long life. And when you talk about satisfaction, you are talking about something pleasurable. But arthritis has become an impediment to the fulfillment of that promise in the life of so many of our aged mothers and dads, whereby they live in pain 24/7. The woman you mentioned about was living in pain day and night. So out of passion, the organization have to come together, be able just to fund her treatment. And everybody is happy today that at least she can have a reason, even though I'm a widow, but at least I can have reason to thank God the remaining days of my life. So that's basically what we have been doing in a couple of years back.
Doc, a lot of our people actually go through such pains, yet they do not know how or what to do. Now, to prevent a situation like that, we would need you to explain why or how we shouldn't get to that level. But permit me to play this video so that people understand that this could just be their problem and not the demons that, you know, they claim are after them. Amazing.
Yeah, it's quite amazing, no doubt about that.
I mean, how did you come about that? Because the whole thing is like magic.
Yeah, it's not actually magic, but it's something that is practically doable.
Obtainable.
Yeah. It is unfortunate that that's exactly what most of our,
Women.
older ones suffer. Both men and women actually, but the interest children do have for their mom, so, and women cry a lot. So, probably, when you have to talk about arthritis, arthritis simply means inflammation of one or two joints. There are different types of arthritis. Majority of them are autoimmune, meaning that it is not because of what somebody eats. It's just only the one that has to do with uric acid. A number of them it's not food related and all that. It's sometimes genetic in the sense that it runs in families, most time it runs in family. This particular one you have here is osteoarthritis, and it is very, very common. And it's because of the damage to the cartilage, the biscuit bone. Because of the damage to those biscuit bone, called the cartilage, it will now make the two bones to be in position to fix together. And that's why it's quite a very painful situation.
Now, you said some of them are not autoimmune. Some are. Does that mean that the treatments are different?
No. The truth of the matter is that when the knee is damaged beyond, when osteoarthritis is starting, you have you have the mild, you have the moderate, you have the severe osteoarthritis. All right. To help you being able to understand what that subject of osteoarthritis is, let me just show you something here. Okay. In every human being, you have two bones coming together, and when it comes together, you call it a joint. And that very joint, you have what is called the tendons and some other things to hold them together. But most important aspect of joint that this is the hip bone and this is the leg. There's the femur arm. Both of them are being fixed here. Do you understand? So, but most important thing in osteoarthritis is that you have at the end of this very bone, you have what is called cartilage. Understand what you call biscuit bone. Two things it serves. It serves the smoothness of the two bones meeting without having much friction. Do you understand? In addition to that, if you kill something like a cow leg precisely, if another when you cut the cow leg, there's something like whitish kind of slimy substance that will just come out from the joints. That is what is called synovial fluid. And that synovial fluid, same is in cow, is also in human being. So it serves as a lubricant or something that makes, when it is in this very joint here, you understand me? When it is inside the joints, it helps the two surfaces in the presence of that cartilage so you can move here smoothly and make all the friction. There will be no friction, no pain, and nothing. All right, because this area cartilage is waterproof. It doesn't allow the body to absorb that fluid, that synovial fluid right there. So as long as this very fellow is alive and there's no problem with this cartilage, that this biscuit board, the fellow can keep on marching, no problem. That very fluid will remain in that place. Do you understand what I mean? So it serves as a lubricant, it serves as, making the movement smooth. But in a situation where there happened to be a problem of this very cartilage where it started getting chopped off, that is the beginning of osteoarthritis. Do you understand me? Inflammation of the joint leading to the damage of this very cartilage. Do you understand? So when you have such a scenario, you cannot have this. Gradually, this is beginning to get eroded. The problem of this development right now is that because this very biscuit bone, which is waterproof, protecting the body from absorbing that very synovial fluid in here, what will happen that when this cartilage is being eaten up, the body will now have the tendency to absorb the more fluid. So they now have this cracking sound where some people will now fold their legs, you hear crack, 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 crack. James kind of a thing. Because inside the joint, you don't have enough fluid, and over the time of this damage of this cartilage, that's when it start moving, he said it's pain and all that. So over the time, you will now have something like this, which is what is also in that woman you saw. So when the whole cartilage and the now bone is being chopped up this way, what will happen is if this side now is the one that is being chopped up, the leg will either bow or become a K-leg. Do you understand that kind of a thing? So this very fellow will not be in position to work. Most of them, unfortunately, will start taking up all these non-steroidal anti-inflammatory drugs, and most of those drugs also affect the mucosa of the intestine, giving birth to ulcer. So that's why most of those arthritic patients will also end up becoming ulcer patients. Do you understand? So that is just the implication of it. So basically what you saw in her is what a kind of thing you can see here. Fundamentally, you have in osteoarthritis, you can have pain, you can have redness, you can have swollen knee, and sometimes also can have deformity and inability to make move. So that's very typically what happened in that way. I think you have a better understanding.
Yeah. Wow. Wow. Okay, Doc, how can we prevent such a situation? In fact, some of them that are arthritic right now are not as old as, maybe the woman that I saw. I know of 50-year-olds suffering arthritis. Why or how can they prevent that situation before they get to that age?
The bottom line in terms of prevention is the issue of exercise. Just liken your joint to the hinge joints of a door. When the door is not in use, over the period of time, the hinges will start getting rust, and the door that used to open very freely will now start having a crack sound. So that very sound, because of the friction, has actually grown over time. So if you actually engage in exercise has a way of reducing the time of manifestation of osteoarthritis, and also the issue of weight reduction. So all those ones are there, but it is not related much to food, even though it's when you get over 50 you reduce your red meat intake. Besides that, there's little much to do in terms of prevention. So but this kind of situation you see here is quite a very pathetic one, because most people that have it, like this particular woman, has been taking a lot of these non-steroidal anti-inflammatory drugs, that painkillers. Some of them will take the painkiller until they start having ulcer. Right? So when we got that very outreach program we did, for which we saw her in her both clinical state and financial state, so the foundation decided to sponsor her treatment, and she did what is called painless and minimal stitch knee replacement surgery.
Doc, I would like to say a very big thank you on behalf of that widow that did not see any help until Doctors Save a Life Foundation found her and actually attended to her medical needs. In fact, what you have done to not just one woman, but the women folk all around the world. I would say thank you to Doctors Save a Life Foundation, and I say keep doing the good work, never stop at anything.
You and Your Health is brought to you by Doctors Save a Life Foundation.
Aging without going for a health check could be likened to driving a car without dashboard. Coronavirus has been able to let us know that if you lose money, you lose something. But if you lose your health, you lose everything.
You and Your Health with Dr. Richard Okoye is brought to you by Doctors Save a Life Foundation.